Well, the battle over repealing and replacing the Affordable Care Act continues with a vote from the White House expected on Thursday. Meantime, or make that the House rather. Meantime, the people who work with the low-income and uninsured are left to prepare for what that could mean for them.
Yeah, the report from the CBO predicted that the GOP health care plan was, if it was approved, it would reduce the federal deficit by $337 billion, but it also predicted that 24 million more people would be uninsured by 2026. So we wanted to bring in Bart Charlow, the CEO of Samaritan House, to talk about the potential impact. Thanks for coming in.
Good morning.
So let's talk about what Samaritan House does. It serves the low income and uninsured.
People who are low income, generally those who are still working but they're living in poverty. So we do everything: food, shelter, clothing, health care, financial empowerment, and we are real experts in health care.
So when we talk about the impact, and you guys are watching this closely, there are some real on the ground impacts for the folks you serve and the other people who might be coming into your door saying, now we need service. Tell me about what you guys think is going to happen.
Well, after 25 years of running the 2 free health clinics in San Mateo County, we've seen a lot of changes. So when Obamacare came in, our demand went down to a more manageable level. We only treat those who are uninsured and who can't afford care. So those are the folks we're seeing. What we expect with the GOP bill is it's going to not only go right back up, it will probably go farther. So our demand will double within the first year.
And you're a nonprofit. Yeah. Everything is, donations and corporate help. How do you manage that if you have to double your output?
Well, all of our physicians and nurses and dentists, they're all volunteers.
Right.
So these are people who are giving of themselves, and it's a really wonderful thing that they do. But there is a limit to how much time they can give. And changes like this in the healthcare system that take a meat axe to all of that care are going to make it more difficult for them to have the time to donate.
When you talk about the number of visits, when you say doubled, you had 10,154 patient visits to your 2 health clinics last year. So when you talk about, now you got 20,000 potentially coming through the door. What do you think the biggest misunderstanding about the people that you serve is out there? Because there's been a lot of this back and forth with, is this necessary? Do we need it? Is it a drain on the system? Is it not? What do you think when you're talking to people about this issue, your message?
Well, here's the reality. We all need good healthcare systems. The first time an epidemic hits, and believe me, there are plenty of bugs out there waiting to hit us, the first time that hits, you discover just how vital it is to have everybody get preventive health care or early intervention in the community. But this is people who are working. They are trying to raise their families. When they get sick, it's a tremendous loss to our workforce, to our businesses, and it's calculated in millions and millions of dollars. So them not getting that health care is foolish. It is not a real savings at all.
And are they talking about it now? Are you hearing from people saying, oh my God, what are we going to do? We might have to knock on your door?
We are. We're hearing from the people we used to serve who now have some kind of care under Obamacare who know they're going to lose it.
So in terms of kind of how you view this, we just had the story on Meals on Wheels, and we were talking in the break about if that program loses funding. As a system, when you guys are all interconnected,
yes,
and nonprofits working together, is there panic within the system right now, and all you guys folks talking and going, how are we going to manage this?
We are all deeply concerned because the budget overall, it's not just the Health Care Act, takes a meat axe to the basic safety net programs that we all depend on. And it's really vital to have that in our communities.
Meals on Wheels was saying it's getting more donations now, and as this news hits, are you getting more support with the work you guys are doing at Samaritan House?
We're not pushing on that just yet. We do have a fundraiser coming up on Friday with your friend and mine. Heather Holmes is the MC, so it's a lot of fun. So for the folks in San Mateo County who want to help us honor our superheroes of health, go to our website, sign on, come on next Friday and have a good time and help support health care.
But certainly, do you feel like there's going to be more calls to action if the money goes away from here? You got to go find it somewhere else.
We absolutely will have to find it somewhere else, or people will not get care. They'll be sick. Nobody wins.
All right. Well, Bart, thanks for coming in.
Thank you. We appreciate your time.
I'm going to sneak a hand over too. Good luck. Good luck. I hope things work out for you.
All right. Well